what would you like to go over next?
Can we talk a little bit about the diabetes insipidus and SIADH?
Okay, let's do like some lab values for each. Just kind of differentiate between the two. Tell me what's happening in our patient with diabetes insipidus.
So that's when they're peeing a lot, right?
Yes.
So they're peeing a lot of very dilute urine.
So what is my specific gravity going to be?
Very low.
Good.
It's going to drop.
And their sodium levels are going to be high in the
Good.
body.
What about hematocrit?
Hematocrit would be low. Or high, it would be high.
Good. Because if you think about in 265, when you spun your blood and you've got like your red blood cells and then your plasma, then if we take off that, then it's going to be more. Does that make sense?
Yeah.
Okay. Hematocrit, what else do we look at? Serum osmolality?
That's going to be high.
Good. What about, I think that's all that I could think of. All right, let's do
And ADH hormone would be none. There would be none or low, right? Yeah, that's what causes it.
Yeah. What causes SIADH? I mean, diabetes insipidus. Or SIADH, actually. They both are kind of caused by the same things.
They are caused by the same thing?
Yeah. It just depends on like the manifestation by the patient. So just to give you an example, do you guys remember the transfemoral hypophysiectomy?
Oh yeah. So when they remove the pituitary or part of the pituitary, they remove the whole pituitary gland, right?
In the transfemoral, no, they just remove the tumor.
They just okay.
Because if you remove the entire pituitary, like, there's so many hormones involved in the pituitary, you wouldn't be able to survive.
Yeah. So
Um,
I know.
so basically because that's like a major surgery that can like hurt the brain.
Yeah.
So basically any trauma.
And that would cause diabetes insipidus.
Head trauma.
So head trauma can cause it also. Or any like craniotomy, brain surgery, anything that like could possibly, if we do brain surgery, there's going to be inflammation, of course, because we just like made an incision near the brain, and that can put pressure on like the hypothalamus, which makes ADH, or on the posterior pituitary, which secretes it. So, any head trauma.
Okay, and then SIADH would be maybe that they have a tumor that's
It
secreting
could.
a lot, or
Uh-huh.
what else?
It could also be head trauma, or is transfemoral hypophysiectomy if we accidentally damaged the hypothalamus. They're basically caused by the same things. Yeah, it just kind of depends on the manifestation by the patient.
Different reaction. So SIADH is going to be the opposite of DI then.
So
Okay.
so it's gonna be increase. Sorry.
Yeah, small amounts of concentrated urine, low and sodium, and then they're gonna have the fluid volume excess signs and symptoms.
Good. So what are some signs and symptoms of fluid volume excess?
JVD, high blood pressure, edema,
Perfect. What about the lungs? What would you see in a chest X-ray?
crackles, or fluid.
Good.
You wouldn't see crackles in an X-ray.
So hematocrit's
Crackles
gonna be
look
low.
fantastic.
Serum osmolality low. Perfect. What does it measure, or what does serum osmolality measure?
That measures the osmolality. It measures how concentrated it is, I guess.
Yeah, it measures all of the solutes in the blood.
Yeah.
So sodium is considered one of the solutes that's measured in serum osmolality, but serum osmolality looks at kind of all of the solutes in the blood.
Yeah.
Good. So we've got a patient with diabetes insipidus. What IV fluids would you not want to give them?
Like IV fluids?
Uh-huh.
You would not want to give them hypotonic.
For diabetes insipidus?
Oh wait, I mean that was SIADH. Wait, I have to think about this. This one. You would want to give hypotonic, so you wouldn't want to give hypertonic.
Good. Perfect. They're dehydrated already, so we want to get them as much fluid as we can back into the cells. And kind of replace it as they're losing it until we can stop the cause.
And that's for DI, right? You
Yeah.
use hypertonic.
You would not use
You
hypertonic.
use hypertonic.
You
Use
can use
hypo.
hypotonic. Because we don't want to pull out more fluid from the cells when they've already lost a lot of fluid from the cells. What about in SIADH?
Don't give hypotonic.
Good. Would we want to give them hypertonic?
Yes.
Probably not. Actually, we would probably just give these patients an isotonic, because our blood pressure is already high. So if we take all of the fluid from
True.
the cells, it's going to just make our blood pressure even higher.
So for both, maybe would you want to give isotonic, or for the diabetes insipidus, would you want to give hypotonic?
Just kind of depending on how severe their dehydration is. If they're super dehydrated, the doctor might order one hypotonic and then put them on
like a
isotonic.
bolus and then put them on, okay.
Yeah.
So we have fluid volume overload with SIADH, and with diabetes insipidus, we've got fluid volume deficit.
Good.
Okay.
And with SIADH, they might not have them on any IV fluids at all. They might just have them on a saline lock.
True, yeah.
So here's just a quick question about fluid balance. When oncotic pressure is lower than hydrostatic pressure, the result is leaking of fluid into the interstitial spaces. What laboratory value would reflect a decrease in oncotic pressure? Decreased sodium, decreased potassium, increased fibrinogen, or decreased albumin?
Decreased albumin.
Perfect, because albumin is directly involved in fluid or in oncotic pressure. Which, what is oncotic pressure versus
That's
hydrostatic pressure?
what keeps the blood in the vessels.
Good. So hydrostatic pressure pushes all of the blood out of the vessels into the interstitial fluid or interstitial spaces, and the oncotic pressure pushes it all back into the vasculature.
The hydrostatic pressure is also the blood pressure, isn't it?
Yes. Yep. Yeah, know those terms because sometimes the doctor will say, hey, go take their hydrostatics, and you know that that's their blood pressure. So, I had a doctor do that to me once.
Did you know what he was talking
I
about?
did.
Good.
So, it's kind of scary when like a doctor comes in and starts quizzing you and then you're like, I have no idea what you're talking about.